My name is Linke. I'm a medical doctor and professor of interventional cardiology at the University of Leipzig in Leipzig, Germany. We know from clinical studies that about 10% of patients undergoing transcatheter aortic valve replacement experience a stroke afterwards. Those strokes are due to the erosion of material from the aorta or the calcified valve during the TAVI procedure. There have been devices developed, so-called protection devices, that are intending to filter the embolic material from the bloodstream. However, the efficacy of those devices have never been tested in the past. Our objective was to understand of whether those devices are really reducing the amount of brain damage as a result of TAVI. We required 100 patients being randomized in a one-to-one fashion to TAVI with embolic protection versus TAVI without embolic protection. Using the embolic protection device is reducing the number of lesions as determined at 2 days and 7 days after the TAVI by 50%. In addition, the total volume of dead brain tissue was again reduced by 50% at 2 days after TAVI and also at the 7-day MRI follow-up. We conclude that using the embolic protection device during TAVI is reducing the number and volume of brain lesions as a result of the intervention. Given that the size of brain infarcts is related to neurocognitive and long-term neurological function, we are believing that in bigger studies it might be possible to prove that using the embolic protection device not only reduces the amount of dead brain tissue, but also might result in a better neurological outcome. The next step was a randomized multi-center trial. This trial has been conducted in the US and Germany as a part of the FDA approval process. More than 300 people undergoing TAVI were randomized, and the treatment of those patients has been completed. The results of this trial are expected to be presented at one of the major congresses before the end of the year.